Is your sciatica serious? The one that wakes you at 3 the shooting pain from your lower back down to your foot? I know exactly what that feels like for my patients. And today I'm going to tell you the truth about sciatica that most people online know. I am a spine surgeon. I have operated on hundreds of sciatica cases, but more importantly, I have also told hundreds of patients that they do not need surgery. Today I'll help you figure out which one you are. So what is sciatica really? Sciatica is not a diagnosis, it's a symptom. It means your sciatic nerve, the longest nerve in the body, running from your lower back all the way to your toes, is being compressed or irritated. The three most common causes are disc herniation pressing on the nerve, a narrowing of the spinal canal, and less commonly a slipped vertebra called as spondylolisthesis. Now here's what makes sciatica confusing. The pain isn't always in your back. It can be entirely in your leg, burning, electric, like someone running a hot wire down from your hip to your heels. Patients often come to me thinking it's a leg problem. So what are the red flags you cannot ignore? Before we talk about the treatment, I need you to hear this part carefully. Most sciatica is not an emergency, but some is, and missing these red flags can be devastating. So we'll discuss this one by one. So number one being if you have lost control of your bladder or bowel. You cannot hold your urine or you cannot feel when you need to pass motion. Stop watching this video and go to an emergency room. Now this could be a condition called cauda equina syndrome and it's a surgical emergency. Number two, foot drop. If you are walking and your foot is flopping, if you cannot lift the front of your foot, that's a neurological emergency. Don't wait. Number three, pain that started after a fall, an accident, or is getting rapidly worse every day. Get evaluated. 90% of sciatica resolves without surgery. Let me say that again. 9 out of 10 patients I see with sciatica do not end up on my operating table. What works? Structural physiotherapy, not just bed rest. In fact, bed rest is one of the worst things you can do. Anti-inflammatory medication in the short term, specific exercises which I'll cover in a separate video, and time. Most disc herniation actually shrink on their own over 6 to 12 weeks. The goal of the conservative treatment isn't just pain relief, it's to give your body the chance to heal itself because it often can. So when do I recommend surgery? Three main scenarios. First, those red flag symptoms I mentioned earlier, those are absolute indication for surgery. Second, when conservative treatment has genuinely failed, if you have done 6 to 8 weeks of proper physiotherapy, your pain is still disabling, and MRI confirms a disc herniation, matching the symptoms, we talk surgery. Third, quality of life. If the pain is so severe that you can't work, can't sleep, can't function, sometimes early surgery is the kindest option. We have a minimally invasive procedure called endoscopic discectomy. Small incision, patients are walking the same day. Most go home the next day, recovery is fast. So here's the bottom line. Sciatica is common, it's painful, but usually treatable without surgery. The key is getting the right diagnosis, watching for those red flags, and not letting anyone rush you into something you don't need or delay something you do. If you found this helpful, subscribe because every week I am going to break down complex spine problems in plain language.